Truthfully, as long as sperm ends up getting deposited inside the vagina, the position really does not matter. And no, you do not need to put your legs up in the air or a pillow under the hips or do a headstand or anything like that. I mean, when you think about it, even if you put a pillow under your hips, you're not really raising your pelvis all that much. Or even if your legs are up in the air, you're actually not moving your pelvis at all. So none of these things are actually going to get the sperm to where it needs to go. It's really, really not necessary.
Hi, superhumans. I'm Dr. Mavis Garcia.
And I'm Dr. Wise.
We're two of the physician leaders at Markham Fertility Center, otherwise known as Our Baby, MFC.
As fertility specialists, we've witnessed firsthand the challenges, triumphs, and the myriad of emotions that come with trying to conceive. Whether you're just starting to think about having a baby, actively trying, or facing challenges along the way, My Fertility Podcast will be your go-to resource for honest conversations and a supportive community.
So grab a cup of coffee or tea and settle in, and let's demystify the world of fertility together. I'm so excited about this episode.
This is going to be a good episode. It's spicy.
Yes, I like spicy.
Well, yes, you're Cuban.
Of course. So in this episode, we're going to talk about sex. I just said it.
I love it. I mean, we spent so much time kind of talking about it, but not really talking about sex per se. It'll be nice to kind of get to the nitty gritty and actually go through all those big questions that people have.
One of the most common questions we get asked in our fertility practice is, am I doing it right? Am I getting the timing perfect?
Yeah.
You know, could that be the reason that I'm not getting pregnant because we're not doing it at the right time? So we're going to get right into it.
Yeah, absolutely.
We're going to answer all of your questions about how to time sex to maximize conception, how often you should be having sex, do you need to use lubricants, and if so, which ones? Does position matter? Do you need to do anything after sex to increase your chances of pregnancy? And we're also going to explore about, let's be honest, let's call it the burden of timing intercourse during trying to conceive.
For sure. And so before we get too deep into it, I think it's important to talk about conception in general and conception rates in humans, right? To kind of give a bit of context. So for a couple in their 20s and early 30s, each month, they have about 25% chance of conceiving with intercourse. After about 12 months of trying, we expect about 85% of couples will conceive naturally without any special ovulation predictor kits or timing or calendars or basal body temperature monitoring or anything like that. The big thing is, though, that this declines with age. So as we've said before, and we'll say many, many more times, you know, the age of the woman, the age of the egg is the biggest predictor of pregnancy, whether it's getting pregnant naturally or by IVF, etc. So by age 40, the chance of a woman getting pregnant each month drops to 5%.
So even if you're doing everything right, or even if you're not timing things perfectly, like you're saying, the ovulation predictor kits and the basal body temperature, we do know that it can take multiple cycles to achieve a pregnancy.
Yep, absolutely. And that is totally normal.
Speaking of timing, let's talk about the fertile window. And we went into details on this in the prior episode about the menstrual cycle, so you can refer back to that episode. The fertile window is the time when sex is most likely to lead to pregnancy, and it can last about 7 days. It is defined as 5 days prior to ovulation, the day of ovulation, and the day after ovulation. So it's actually a pretty long window. It's not a one-time deal.
Oh, yeah, absolutely. And the next thing to think about is, how do you time sex to maximize conception? There's actually a lot of studies and a lot of literature published about this. So one of the big ones was that there was this big study published in the New England Journal of Medicine. The super fancy, highest, most fancy medical journal. And they published in 1995 this article. They looked at 221 women between the ages of 25 and 35 who wanted to become pregnant. They were trying for about 2 years. So they looked at about 625 menstrual cycles. And they did daily urine samples to figure out hormone levels. And they were documenting when they were having intercourse. And this is the study that showed us that conception can happen up to 5 days prior to ovulation. And specifically, the chances of conception was 10% of having sex only once 5 days prior to ovulation. And it was 33% if you had sex 2 days prior and 1 day prior in the day of the ovulation.
This is actually really good news. It means that you don't have to time things exactly on the day of ovulation. And that can really take a lot of the pressure off.
So it's not like the movies where you
No,
see
right?
like the couple running into like any random storage
Right.
closet because ovulation is
Yeah.
happening at that
Right.
moment.
But I mean, patients get really anxious about this. There are a lot of times they tell me, oh, last month he was away for one day and I was ovulating and it was all over. And
Yeah.
so I think it's really important to know that you've got 7 days. You can do it every day during 7 days. You can do it every other day during 7 days, or as long as you're getting it during that window, once or twice, then you're good.
Exactly. And that's a key message. Only needs to be once or twice. Does not need to be multiple times per day,
Right.
because I've gotten that question before too.
Right.
Yeah.
Now, how do you know if you're ovulating? Well, if you're having regular cycles, there's a very good chance that you're ovulating. If you refer back to the episode prior when we talked about the menstrual cycle, you learn that menstruation, which is having a period, comes from the decrease in progesterone, and the progesterone goes up after ovulation. So having regular menstrual cycles is a very, very good indication that you're ovulating regularly.
And with regular cycles, so we always talk about the average menstrual cycle being around 28 days. So that ovulation window will actually be around day 10 to 16, because ovulation is probably happening around cycle day 14. So if you have a longer cycle, you can always think that your ovulation is probably happening about 2 weeks or 14 days prior to your previous cycle. So that's how we kind of count it back. So again, if you're ovulating around cycle day 14 with a 28-day cycle, that fertile window will be day 10 to day 16 of the cycle.
Yeah.
And so it's also worthwhile to mention again, day 1 of your menstrual cycle is always the first day of full bleed, and not the day the period stops. This is one that messes up people a lot in terms of counting. So first day of full flow, just by convention, that's the first day of your menstrual cycle.
Exactly. Another way to know if you're ovulating is using the ovulator predictor kits. Again, the tests are going to be negative 5 days prior to ovulation, yet you are in the fertile window. So if you're going to use them, just be aware of that. I would recommend using the ovulator predictor kits maybe 1 or 2 cycles just to get a sense of when your ovulation is happening. But you don't need to use it every single cycle.
Yeah.
When you already have regular cycles and you have an idea that you're ovulating. Some women also experience symptoms during ovulation, such as a change in cervical mucus, breast tenderness, and increased libido.
Another really important finding in this study that we just talked about was about the frequency of intercourse during that 5-day window. What the study showed is that the chances of pregnancy for each time that you had intercourse, from none to daily during the 6-day fertile window. And they said whether you have intercourse 3 days, 4 days, or 5 days in that 6-day window, chance of pregnancy were the same. So you really don't need to be having tons of intercourse to be successful. Sometimes intercourse, while you're trying to conceive, can really become like a chore. And so it's really important that people know that it doesn't have to happen every day if you don't want it to, and that's totally fine. You're not decreasing your chances of success.
Absolutely. Trying to conceive is stressful as it is, and then having to add this, like, it needs to happen every day and it needs to happen now.
Yeah.
At this particular time can really add a lot of stress and performance anxiety as well.
Absolutely.
So not the topic of discussion here, but another interesting finding that came out of this big study published in the New England Journal of Medicine that Dr. Weiss was talking about is this notion that sperm that stays in the fallopian tube longer can lead to girls, and sperm produced at the time of ovulation can lead to boys. Have you heard that?
Actually, no, I haven't. That's
Yeah, I
interesting.
definitely have heard that. This is a myth that if you have sex like 5 days prior to ovulation, you're more likely to have a girl, because sperm that can live in the fallopian tube longer is more likely to lead to girls versus sperm that isn't. And there's no truth to that. Again, the study following couples, many cycles were studied, showed that the timing of intercourse had no bearing on the sex of the baby at all, and also no bearing on the risk of miscarriage.
Interesting. And so while we're on the topic of the ovulation window and sperm, this is another really important one to discuss. And it's this idea of, quote unquote, like saving up sperm for ovulation. And this is like totally wrong.
Yes.
Like absolutely not a great idea. So sperm gets produced in the testicle and then it sits there. And as it's sitting in the testicle, it starts dying off. And so you might get more sperm with a longer period of abstinence, but the motility, so how well the sperm swims, goes down. And then the morphology, so the appearance of the sperm and how they look, also decreases as well. And so really what we've seen is that the best sperm for conceiving is actually going to be fresh sperm, meaning that's something that's coming from 2 to 5 day period of abstinence. So there's absolutely no utility in trying to save up sperm or not ejaculating until ovulation is happening. It's actually detrimental. It actually has the opposite effect.
That's right. And that's why when patients are coming for IUR, IVF, or even for a semen analysis, we always tell them 2 to 5 days of abstinence and no more. And sometimes we do get those like 14 days, 21 days of abstinence, and you can really tell the impact of sperm.
For sure.
Yeah.
And there's just no good swimming sperm in the sample sometimes.
So another common question that comes up is the use of lubricants during intercourse when you're trying to conceive. So here's the deal. You don't have to use lubricants. Lubricants do not make sperm better, stronger, or faster. However, it is a known fact, like we said, it can become stressful, and that can lead to decreased vaginal lubrication, which can lead to vaginal dryness, which can lead to discomfort during intercourse. So if you need to use lubricants for comfort, not to make sperm better, but for comfort, that's absolutely fine. It is important to avoid any lubricants that are oil-based and to look for lubricants that have specifically been formulated to be sperm-friendly because they match the pH of semen and therefore they wouldn't be affecting sperm quality and motility. Sperm-friendly lubricants are usually water-based and they're formulated to match the pH of sperm. Some examples are Pre-Seed or Cestica. Saliva is not considered sperm-friendly due to the pH and the enzymatic action.
I actually have seen Pre-Seed sometimes at like Shoppers Drug Marts and other pharmacies, but it's a little bit harder to find. But, online you can always find it.
That's right.
All right, so now let's get into the nitty-gritty even more here. So positions during sex, male orgasm, female orgasm, and all these other things. Actually, none of these things really matter all that much when a couple's trying to conceive. Truthfully, as long as sperm ends up getting deposited inside the vagina, the position really does not matter. And no, you do not need to put your legs up in the air or a pillow under the hips or do a headstand or anything like that. I mean, when you think about it, even if you put a pillow under your hips, you're not really raising your pelvis all that much. Or even if your legs are up in the air, you're actually not moving your pelvis at all. So none of these things are actually going to get the sperm to where it needs to go. It's really, really not necessary.
And another thing that people tell me is like, oh, after intercourse, I get up and then I get this thing that comes out.
Yes.
And that's a very common question.
Yeah.
So that thing that comes out is the seminal fluid. The moment that male ejaculation happens, the sperm actually swims up from the cervix into the uterus, and then the seminal fluid stays in the vagina, and that is the discharge that you get after intercourse.
Yeah.
So it doesn't mean the sperm is leaving and that you're not pregnant anymore.
Exactly. Sperm has to exit the vagina and get to the cervix really, really quickly from the time of ejaculation. And so by the time that you're getting up and things coming out, that sperm is not the sperm that's going to be helping you get pregnant anyway.
So male orgasm obviously is necessary because that is sexually ejaculation. Female orgasm is not necessary for conception, but we got to talk about this.
Yes.
It doesn't mean it's not important. So there's actually been some theories that female orgasm may facilitate the movement of sperm in the fallopian tubes. In reality, I think the impact to conception is minimal at best. So let's be clear. We're not saying that female orgasms are not important. Of course, they're very, very important and they matter very much. Female sexual satisfaction is just as important as it is on males, and sometimes it doesn't give them enough attention. As a matter of fact, I would love to do an episode on this whole topic. But from the point of view of conception and pregnancy, there really is not a big impact from female orgasm on conception rates. So of course, female orgasm matters tremendously outside of conception. Of course, women are not just a womb, and they deserve to have as many orgasms as the men.
Hear, hear.
Thank you.
Let's be real right now. So sex when you're trying to get pregnant can be a lot. Again, media, movies, TV shows make it seem like it's super fun to be going at it like rabbits all the time in random places because that's when ovulation is happening. But that's not really the reality of life. And as we all know, it can definitely become mature, and when it's something that you have to do because of the timing, that you're not doing it because you necessarily want to do it, because you have a specific goal in mind, it really can become not fun. And it can definitely lose its appeal, especially when the vast majority of people have to do it many, many months in a row, right? Like, as we said, the chance of pregnancy each month may be 10, 15, 20%, depending on other factors.
And then, of course, women are already worried and they're stressed, and now they have the added pressure of seducing their partner and telling them it's time to have sex and timing the whole thing and being in the mood, and when you don't really feel like being in the mood at all. And then, of course, for the men as well, they tell me they feel used, or they feel like they're just doing a chore, that it's not really about the intimacy and the sexual connection, but it's about the job. And that can lead to performance anxiety. So these things are very common. I hear all the time from my patients. I think what I would recommend is to have a conversation about it. Be honest. Like, just say, this isn't fun sex. This is baby making sex. And then maybe make some time outside of the ovulation window for real intimacy and connection. And intimacy and connection doesn't have to be about sex sometimes.
Absolutely. I think that's a really, really good point. I think the more that you can try and separate it and talk about it as a couple, the more that takes the pressure off of everyone. But that it is normal to feel that pressure, and that it is normal to feel that way. Not all sex is going to be really fun, and that's okay.
And I've also heard a lot from my couples how sexual intimacy can really take a dive during the trying to conceive period, to the point that now they have a baby, and getting back to having intimate fun sex can be really difficult as well. So
for sure,
I think the trauma that one may experience during the fertile years might actually have an impact on sexual intimacy going forward as well. So it's worth talking about it and naming the elephant in the room.
Yes.
And finding times to connect even outside of sex.
And then again, if you're needing more help with that, there are therapists, sex therapists who can help you or help you as a couple work through some of these issues as well. So there is help out there. All right, so let's do a quick rapid fire round here. Quick sex Q&A.
All right, go for it.
Dr. Garcia, can I have sex in the first trimester?
Yes, you can. There is no contraindication to sex during pregnancy. I would say sometimes the cervix can become really friable, and then with sex you might have some spotting and bleeding, which of course during the first trimester, and especially if you're going through fertility, it can be very anxiety provoking. But sex will not cause a miscarriage, and it will not hurt the baby or the pregnancy in any way, unless there are specific pregnancy related complications, like in the more advanced trimesters, you could have placenta previa, and then sex would be contraindicated. Or if you have a large subchorionic hematoma in the first trimester, we would also say no sex for that reason. Now, a question for you. Can I have sex after my embryo transfer?
This is a great question. And this is one that there's actually not really great evidence to sort of support any particular answer around this. And I think it makes everyone a little bit nervous or anxious. What I will typically say to patients is that you shouldn't be having intercourse maybe the day of the transfer, maybe day after the transfer, but a couple of days after, you can resume regular activity, including intercourse. There's no science-backed reason for that, to be clear.
Fair enough, yeah.
But I think it's just that we know that the embryo is going to be kind of floating around for those first 24 hours or so before it implants. So I think we're all just a little bit nervous about intercourse and potentially the impact of sperm and ejaculation and the female orgasm, which can cause some uterine contractions. Yeah. All right, another question for you. So my partner and I, we're going to do an IUI this month. Can we also have intercourse?
Yes, absolutely. It's actually recommended that you have intercourse during an IUI. The more sperm in there, the better. The only thing I would say is we want to have the best possible sperm for the sperm wash, which is happening during the IUI. So we want to have a period of about 2 to 4 days of abstinence prior to the day of IUI. But certainly after the IUI, we recommend that you have intercourse and leading up to that as well, because like we said, we don't want to be saving up sperm. We want a sperm to be produced on a regular basis every sort of 2 to 5 days.
Fresh is best.
Fresh is best. That's right.
And next question here. What about intercourse during an IVF stimulation?
You're right. There is not a great evidence to this. Yes. Some women that have very good ovarian reserve might have a lot of eggs during the IVF stimulation, and the ovaries can be really enlarged, and sex could be really uncomfortable in that situation. So probably wouldn't be a good idea if you're getting towards the close of your trigger time and you're one of those women having loss of follicles. Earlier in the cycle, I think it's perfectly fine. as long as you feel comfortable with that. And then after the egg retrieval, I would say probably for about 48 to 72 hours, because we are going through the cervix, we're putting a needle in. And again, not a really good evidence for that, but I would say to at least 72 hours after the egg retrieval not to have intercourse.
Yeah, absolutely. Yeah, that's what I tell people too.
So there you have it. You don't have to time it perfectly. Now you know what the ovulation window is. And women, please have all the orgasms. You deserve them.
Absolutely. And that's a wrap for today, Superhumans.
If you're looking to connect, get social with us. Follow us on YouTube and Instagram at My Fertility Podcast, or visit us online at markandfertility.com. And don't forget, follow, subscribe, and share your favorite episode.
Thanks for listening to My Fertility Podcast and for being a vital part of our community. We know you've got this.
We're signing off until next Tuesday.
If you found this episode of My Fertility Podcast helpful, please take a moment to head over to the review section and leave us your thoughts. Your reviews and comments are incredibly valuable to us and help guide future episodes. We also welcome you to direct your questions to info@myfertilitypodcast.com.
My Fertility Podcast is produced by Rabbit Media Inc. in conjunction with Dr. Garcia and Dr. Weiss. Music from Mix Kit Raising Me Higher by Ajay Stelino. My Fertility Podcast is not intended to replace any type or variation thereof professional medical, health, or legal advice, nor should the content be taken as medical advice. Please contact your primary healthcare professional regarding any medical questions you may have. The information presented in this podcast is based on the knowledge and understanding of the host at the time of recording. Medical knowledge is constantly evolving, and new research may change the understanding of health-related topics. While we strive to provide accurate and up-to-date information, we do not guarantee the completeness, accuracy, or timeliness of the content. The views expressed in this podcast by guests are not those of the host or the management. This podcast is not intended to impose any type of discrimination. My Fertility Podcast and its management are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast.